My name is Spector. I'm one of the spine surgeons here at OrthoCarolina. I chose orthopedics because my father was an orthopedic surgeon and just fell into the field as a result, kind of looking up to my father. He was the one who initially pushed spine. He thought it was an important area that orthopedic surgeons stay a part of. And then in the end, the folks that I met along my line of training just kind of gravitated to the mentors that I had.
We take care of the patient one patient at a time. We don't group them. You have to take them on an individual merit, and that's one thing that Dr. Spector does, and that's one thing that I do.
I think what makes OrthoCarolina different from other practices is with the scope and size of the practice that we have, it allows us to have physicians that specialize in all areas of orthopedics. We have general partners who are great at taking care of general orthopedic problems, all the way down to very refined specialists, whether it's in spine or hip and knee or foot and ankle. And I think that allows patients to get the level of care that they need based on the problem that they have. I think that oftentimes in medicine nowadays, doctors are rushed for their time, and I think patients feel as though they're more and more a number. My clinic often runs late, and that's because I spend as much time as I need to with an individual patient.
I always tell patients, you need anything, call me. I will call you back. And the same thing for him. He calls patients back at 6, 7 o'clock in the evening. That's the kind of guy he is, and that's the kind of practice that he and I have together.
Well, I was experiencing back pain. It went down my leg, my sciatic nerve, and it got to the point where I couldn't function, couldn't sleep, couldn't walk really that well, and so I went to my primary, and they referred me to a couple different places, and I ended up with Dr. Spector.
I think the most important thing I want patients to know about spinal conditions and injuries, it's important for them to be able to have an open conversation with their physicians. I think there's a lot of misinformation about spine within the general public, and I think it's important that they get a good opinion so that they can understand their condition and how to treat it.
The staff at OrthoCarolina was wonderful. They answered all of my questions. Dr. Spector was very patient with me and went over everything thoroughly with me, all my options.
Although we are a large orthopedic practice, we are still made up of individual doctors that do care about their patients, and that although you're interacting with what could seem like a big corporation, you're still getting individualized care of the provider that you go see. And so hopefully it offers the best of both worlds.
I volunteered for the past 3 years doing the uniforms over at our local high school. I went back to visit recently, and a lot of these parents came up to me and said, "Wow, Linda, you look great. Your face does not show the pain like it's been showing." And they knew immediately that I had something done. And everybody asked, where did I go? And I said, please go to OrthoCarolina if you have any issues. They will fix you up.
The most rewarding part of my job is that interaction with the patients, and it's not just the obvious, which is the patients that had surgery and has had a successful outcome. Sometimes the most rewarding part is speaking to a patient and giving them the advice and education about their spine, letting them know they don't need surgery, and that interaction is the gratifying part of the job.
I just can't say enough about how wonderful he is as a person as well as a professional. And I would highly recommend him to anybody. And OrthoCarolina gave me my life back. Dr. Spector, I can't say enough about how wonderful he is.